पहले तो मैं ये बताऊंगा कि डॉक्टर सुशील राजदान साहब, थैंक यू वेरी मच फॉर बीइंग हियर। उनकी और मेरी कॉन्वर्सेशन करीबन पिछले 6-8 महीने से हो रही है। सर वांटेड टू एड्रेस जनरली हम सभी को, बट पर्टिकुलरली हमारे जूनियर डॉक्टर्स को। ही वॉज वरीड ऑफ समथिंग वेरी बेसिक विच वी ऑल आर इग्नोरिंग दीज डेज, द कनेक्ट बिटवीन पेशेंट एंड द डॉक्टर, which is not as it used to be probably 20, 30, 40, 50 years back. तो सर का काम और सर का इंट्रोडक्शन हम सभी जानते हैं सर को, वो तो मैं नहीं बताऊंगा, लेकिन इस इवेंट के बारे में ज़रूर बताऊंगा कि ये वी आर जस्ट स्टार्टिंग दिस कॉन्वर्सेशन टुडे एंड वी होप दैट बन गया है जहां दोनों तरफ से डिस्ट्रस्ट है, और जब तक शायद ट्रस्ट डेवलप नहीं होगा तब तक हीलिंग नहीं होगी, और हीलिंग बहुत एक अहम हिस्सा है हमारे इस सारे काम का। इसी सिलसिले में मुझे एक कोट पढ़ा था मैंने सुबह, एक्चुअली आई वाज थिंकिंग ऑफ ऑल दिस कि क्या बोलूं मैं सुबह जब मुझे बोलना होगा। तो दे से व्हेन समबडी इज सफरिंग द प्लेस इज सैक्रेड, वन शुड ट्रीट इज एज अ सैक्रेड प्लेस। तो हम सबके पास मौका है, हेल्थ केयर प्रोफेशनल्स की बात कर रहा हूँ, डॉक्टर्स, नर्सेज, सभी के पास वी हैव ए चांस एवरी डे टू डू समथिंग सैक्रेड। आई होप वी टेक दिस विद अस एंड वी स्टार्ट दिस कॉन्वर्सेशन इन दैट स्पिरिट। थैंक यू, वेलकम सर।
Thank you so much, Dr. Murtaza. As they believe that the place where you get treated has to be sacred, it has to be a place where you provide high quality treatment. On this occasion, I would like to request Dr. Nagar to join us on the podium. Since this is the occasion where we have people who really thought of creating a different mindset and take this healthcare story a bit ahead, I would like to thank Trumbu family for having collaborated with Parcel and at least give Kashmir something that is quality wise in nature, and that is something that provides relief to the patients here. And with that, Umar, we wholeheartedly thank you and your entire family and entire team. And
ask him to stand up so that we can see him.
Yeah. Dr. Nagar wants you to stand up so that maybe you can also say a few words why you initiated this later on, and just for a minute you can just share one of your experiences. Why was Paras Health like center needed in Kashmir?
Thank you, everyone. Maybe you all are not aware, this project, Paras Healthcare in Srinagar, was conceived in around 2017-18. It was not before, after 2019 we thought of it, and much before that. When I remember when Dr. Nagar first came here, he was staying in Taj Hotel. Srinagar was absolutely shut. Nothing. It was the peak of hartals and all that time we had. So it is to his, we must credit him, his decision, his vision. When nobody thought that, nobody was willing to come to Kashmir. Even visiting Kashmir for tourism was that time difficult, but he made this bold choice, and I think the journey, we all know how it then happened, and he's very happy, and we are also happy to have contributed to this cause, and finally a good hospital has come up, and there is still dearth of healthcare facilities in Srinagar, and hope with this one it is just the beginning, and the other hospitals which will follow, this is now you are all setting a benchmark for them. Thank you.
थैंक यू सो मच। आज के कीनोट स्पीकर को बुलाने से पहले और उनका सुनने से पहले, देयर इज अ पर्सन हु हैज बीन अ लॉन्ग एस्टेट ऑफ डॉक्टर सुशील राजदान, समवन हु हैज क्लोजली वर्कड विद हिम, दे हैव बीन फ्रेंड्स, दे हैव हैड चिट चैट्स टुगेदर। प्रोफेसर डॉक्टर वहीद, द फॉर्मर हेड ऑफ इंटरनल मेडिसिन, शेर कश्मीर इंस्टीट्यूट ऑफ मेडिकल साइंसेज, सर ब्रीफली अपने एक्सपीरियंसेस और डॉक्टर राजदान को आप कितना क्लोजली जानते हैं एज अ प्रैक्टिशनर, एज अ न्यूरोलॉजिस्ट, और आपसे यहाँ जानने की कोशिश करेंगे.
आपको अच्छा लगेगा.
Respected colleagues on podium, Dr. Sushil Razan, Dr. Muzaffar Habib, Dr. Darvinder Nagar. I have seen Dr. Nagar for the first time, but I have heard a lot about him, especially from Dr. Sushil, my friend. He is a wonderful person, a struggler, a visionary. He is a man of ideas. You know, Kashmir has witnessed a turmoil over last few decades, and investment in Kashmir was considered as a big risk. But Darvinder ji made it possible to establish a hospital of this stature, of this class in Kashmir. This reflects his love and faith in Kashmir and Kashmiris. Give him a big applause. Distinguished colleagues and friends in the audience, I know most of them. They have been my colleagues in Sikkims. My friend Sayyid Manzoor Qazi, Mr. Nisar Gilani Sahab, I have invited him. He has worked as an anchor in TV for over 50 years and has interviewed all reputed doctors over 4 or 5 decades. I feel privileged to have been invited to this session by Pars Health Srinagar. You see, it is a beautiful topic selected by you. The topic is healing with honor, ethics and empathy. There is a complete message in the topic itself, and it carries with it the full purpose of this meeting. You see, doctors have been. Before I start, I will tell you 2 interesting things which I experienced this morning only. I was in my clinic. A patient had gone to see a doctor. The doctor had prescribed some medicines, but to the disgust of the patient, he could not get the medicines from any chemist shop. He visited reputed shops in Lal Chowk, Karan Nagar, Sora, all important hubs of pharma trade, but could not find the medicines anywhere. Ultimately, he went back to that doctor's clinic and purchased the drug from his shop. The drug was available there only. The patient came to me. He had exhausted himself. He was tired. He was disgusted. Now, what do you say about this? I leave it to you for introspection. And another patient, a neurologist, not Sushil, another neurologist, had asked his patient to do an MRI spine. He got it done and came back to the doctor. The doctor, without seeing the MRI, felt annoyed, looked annoyed, and told him to get it done from a specific particular diagnostic center. The patient narrated his plight. He was feeling helpless. He felt sorry that he had consulted a doctor who served his own interests. I again leave it to you for your introspection and discussion. Anyway, I feel privileged to have been invited to this meeting. You see, doctors have been considered next to God. Patients have all along held this profession as a noble mission, and doctors and nursing staff have enjoyed a respectful place in the society. But now the times have changed. With the advent of technology, a doctor seems to have said goodbye to the human touch, which was the characteristics of this profession. And patients feel a disconnect sort of this thing, of this human touch with our healthcare system. The patients look half satisfied. Let us accept this bitter fact. There are increasing number of litigations against doctors, individuals, nurses, hospitals, both private and public ones. The litigation warrant sends shock waves. If it is against a government hospital, it is like a drop in the ocean, because a government hospital has tremendous safeguards. But for a private hospital, the litigation is not a drop, it is an ocean itself. Confident, see every possible risk should be disclosed to the patient. Even a remote risk should be disclosed. A patient goes to the doctor after careful selection. This is very important. A patient goes to a doctor after careful selection. He selects his doctor or a hospital after having heard a lot about him and after having assured himself about the doctor's experience, competence, his behavior and attitude. So he comes to see a particular doctor with great expectations. If the doctor doesn't spend time with the patient, doesn't listen to him with concern and affection, and doesn't take care of his emotions, he is failing in his job. The patient rejects him and a trust deficit starts beginning. The patient leaves the clinic in despair. You know, history taking will never be replaced by technology. History taking establishes a rapport and a communication with the patient. I remember a lady, this is a fact, I remember a lady who was advised by a surgeon to do an ultrasound to rule out gallstones. The lady asked the surgeon, "Dear doctor, you have yourself removed my gallbladder just 1 year back." Now think what impression the lady must have gathered about the doctor. Isn't history important? You know, we know, and everybody knows, medical science is full of uncertainty. A drug gives good results in one patient, poor in another, and causes reaction in third. The doctor has to take drug history, history of allergies, history of previous surgeries, and must use one of the many recognized and accepted methods of treatment prescribed by medical profession. Accepted methods of treatment is very important. A doctor starts treatment according to his findings, according to his knowledge and experience. Another doctor gives a different opinion, different line of treatment. Difference in opinion is not negligence. If both the doctors follow accepted and prevailing methods of treatment, what does this mean? A doctor has to be updated. What is recent in medicine, and what the treatment is given universally. Similarly, a good surgeon is not a surgeon who only knows how to operate, but it is he who also knows when not to operate. Now, regarding admitting patients in a clinic or a hospital, you should think twice before admitting a serious patient if it is beyond your skill and knowledge, or if the supportive facilities like equipment is not available in your hospital. Explain these problems to the patient and relatives in a calm and assuring way, because shifting the patient already admitted in a private hospital to a government hospital when condition of the patient becomes critical creates doubts in the minds of people, and genuinely so. It can lead to chain reactions from public, and doctors might have to face litigation. So be honest in the first instance while admitting a patient. Reference is not cowardice. Refer the patient to appropriate consultant or hospital. But that does not mean you will ignore your basic duty. If a doctor refuses to treat a patient, if you refuse to treat a patient with pleading and is brought by a crowd, you have to give some emergency treatment or whatever is needed. Think of the reactions of the crowd. Admit the patients if you have the facilities and are confident about the skill of the doctors. In the absence of these, refer the patients calmly and in a polite manner. Explain the grounds of referral. Handle the situation with knowledge and empathy. However, shunning your responsibility of admitting patient should not be your strategy based on fear, but a considered opinion based on knowledge and scientific facts. We know we should keep all these facts in mind, and we know that this profession is governed by law and ethics. And so far as doctor is concerned, he must have two things, knowledge and empathy. If a doctor has only empathy and no knowledge, he is a good human being but cannot be a good doctor. Rather, he can be an apology. Similarly, if a doctor has knowledge but has no empathy, he is not a human being. He has to have empathy, compassion, and honor for the patient. Patients are really forgiving if the doctor behaves with respect, courtesy, and communication. Communication solves most of the problems. Now I'll tell something about the supportive staff which a doctor engages in his clinic. Supportive staff is very important. They are the first who see the patient, and patients meet him the first. They streamline the crowds, they absorb anger of the patients, anger of the crowd, so they have to be treated like a family. A doctor should take care of their needs, but at the same time, surveillance of staff, supportive staff is very essential, very important, because at times the staff can create problems. Suppose a patient, a staff behaves very rudely with the crowd, a problem arises. Similarly, if a staff member or a staff means this clerk, a peon, or a receptionist, if they accept bribe just for giving an earlier date of appointment, this creates disgrace. This creates a problem. He has to be taken to the book. Most of the doctors are embodiments of empathy, embodiments of courtesy. Most of them are communicative. Patients feel happy to consult them. I remember Dr. Adijan, his bedside examination would be inspiring. I know him as my teacher. He also would compare the cost of two similar drugs of similar quality and would write the drug which would be cheaper, cost effective, even if there would be a difference of 2 rupees. So far as empathy is concerned, I have long before told it to Dr. Sushil also that I was a college student. My mother wanted to have a consultation with Dr. Nasir Sahab. My father was dead. I was the eldest. I took my mother to Dr. Nasir, and he asked me, "What are you doing?" I told him, "I am a college student." He told me, "What is your father doing?" I told him, "My father is dead." This changed the color of Dr. Nasir Sahab. He asked his secretary to pay back the fee. I told Dr. Nasir Sahab, "No, I have no problem with money. My grandfather is alive." He told me, "Hey, Kar Sahab, take this back, take this amount back." And he stood up and opened his almara and gave me the samples he had written. How can I forget him? How can I forget his empathy? I know Dr. Sushil as a colleague for last 50 years now. You will not believe, I refer most of my patients to him, and the patients come to me. They say that we look at the face of the doctor and we feel relieved, we feel cured. This is, give him a big hand, please. With all these words, I feel I have bored you, I have taken your time. Thank you so much. Thank you so much.
Thank you so much, sir, for your valuable insights and reminding us how doctors used to treat in your times. I would request Dr. Qazi, Manzoor Qazi, he is a senior orthopedic surgeon, to give us briefly his insights.
Shall I go up on this? I'm tall enough. Hi everybody, ladies and gentlemen. Most of you don't know me, but I'm excited to be here today. It's 3 years after we started this hospital, and you have rarely seen me here. But thanks to the gentleman here, I have been associated with the Pars Hospital since the inception of this idea happened. And the two great speakers here, I'm proud today. Dr. Nagar was having dinner in my house in Gurgaon. We wanted to recruit few doctors from outside who would give color to the... I gave him 3 to 4 names. Look at that smartness. He said, Dr. Razdan on the top, who is this guy? I said, he is one of our ace physicians, and he picked him up. I arranged a meeting between Sushil and him. They met almost 3 to 4 months after that. So I'm proud today. I see both these legends here on the side. Now, my association with this Pars organization has been long before this thing. When I met Dr. Nagar, while I had some privileges, I used to operate in Pars, Gurgaon, and we met. We kept the contact. He was always, I learned a lot from him. I told him in the morning also. I was skeptical about establishing an institution like this in this part of the country. We had a lot of problems in Kashmir, from political to economical and all those things, but he was always encouraging. He told me one day, I said, Dr. Nagar, I am doubtful this thing is going to survive. He said, listen, when I started Patna, people told me the same thing. It will not succeed, and now Patna is doing the best of all the Pars hospitals. So I have taken a privilege I have to do it. And today, you're seeing this place. I'm excited to see a facility like this has come up, and hats off to you for investing, for everything else. And my hats off to you, sir. Yeah. And then I have a few things to say. Your vision. I'm not talking professional today of the medical malpractice and all those things. I deviated it because I was injected into this speech just by chance that I was here. He told me one day, milk runs through my veins. I don't know, many of you people know. Pars was the biggest dairy product in India ahead of Amul, and his family owned it. So he used to say, milk flows. But today, I'm sure, inshallah, the Kashmiri saffron will flow through your veins. And our other things will flow in your lungs. And we're happy about that. Well, again, another thing which impressed me. Before that, I'll go to you after that. I'll go to you. When it was a core and shell, I came here, I met you, your father, and I was looking at this, what is this? How can we make it into a hospital? It's not going to be like that. And I told Dr. It's like, looks like a ghost house. But you did it. Wonderful. Regarding Dr. Nagar, he told me one day, I am going to be the second biggest employer in the state. Today, I was told that we have 550 employees about there. Good, wonderful. We as Kashmiris should bow our head towards you, and they are our people who are employed here. 550 people. There are multitude of problems in this part of the world, this part of the country particularly. Kashmiris are a different character than anybody else. Our ethics has to be really modified. Looking at the population ratio, the type of people, the geographical situation of Kashmir, the political situation. I'll tell you an example. If you go to an ethics, when we started this hospital, second day a VVIP patient comes for a revision, total knee replacement, very important patient. My colleague, enthusiastic Hasib, there, tells me, sir, we should do this patient because this is going to be a jack for the hospital. We will rise to the top. Wahid just said one thing. It is very important to know when to operate a patient. Very more important is when not to operate. I told him, people here don't accept any mistakes and all those things. And this is where our ethics has to be a little bit modified here in this part of the world. It's a small place. They blow up small things like anything, and that's it. Last, Murtaza. My first meeting with Murtaza was on a televised screen. I was sitting with Dr. Nagar in Gurgaon. Murtaza Sahib comes and I look like this. Is he a Kashmiri? But that was wonderful. That was your first entrance here. Impressive, and everybody is praising you. I know how difficult it is to be an administrator. I used to come to this place quite often. When I started coming here, I made some enemies also. And one of the hospital owners told me, she has new pursuant doctor, and one of them is here. Your CBT. She has new aspect doctor. But I didn't mind it. Anyhow, I'll close it down on that. Dr. Nagar, for us you are an angel. For us you are an angel. Believe me, most of the Kashmiris would not invest, would take this chance in those situations that you did. God bless you.
Thank you, Dr. Kazi. I think your association with Dr. Nagar speaks itself, because you have been gracious enough to paint the whole picture. We're also glad to have with us Dr. Naveed Nazir, the head of chest medicine, Government Medical College, Srinagar. He also comes up with a lot of energies. He also believes that the patients need accessible treatment and also need dignified and honored treatment and compassion. Since post 2019, Jammu and Kashmir also has undergone a lot of political and constitutional change. But I personally believe, Dr. Nagar, that Paras has been a great success story as far as the investment is concerned. Post 2019, we have seen a lot of things being talked about, but Paras has definitely taken a lead in that way. It has been established with a lot of doctors coming from Dubai, from different countries, even from UK, who have chosen to be back home and start working here. And at the same time, I was speaking to the HR. From the HR point of view, this is definitely a great source of employment in Srinagar right now, in Jammu and Kashmir right now, and for that you definitely deserve a huge round of applause. We are definitely glad to have with us some of the finest journalists. For them, this is not a story. This is going to be a kind of a conversation. But they chose to be here. Nasir Ganai, the bureau head of Times of India, Pirzada Ashik, bureau head of The Hindu, Amir from the Kashmir Monitor, and some of the other journalists who time and again come and understand the health scenario and health landscape of Jammu and Kashmir. I would now request मैनेजिंग डायरेक्टर पारस हेल्थ डॉक्टर धर्मेंद्र नागर। सर, आप कश्मीर में आए, इससे पहले आपने बहुत सारे सेंटर्स को इनॉग्रेट किया, और आज के हवाले से चूंकि डॉक्टर सुशील राजदान हु इज़ a household name here, so you chose to be here on this program. You thought this is very important. Please share your thoughts.
Good afternoon, everyone. I'm humbled and honored. इतनी तारीफ मैंने रिसेंटली अपनी ज़िंदगी में नहीं सुनी है, सो बहुत बहुत शुक्रिया। सबसे पहले मैं शुक्रिया देना चाहूँगा कश्मीर का। I had a mission, I had a vision. I knew what I wanted to do. I knew what the challenges are going to be. You'd be surprised कि मुझसे लोग कहते हैं कि यार यहाँ इतना ये होगा, ये मसला आएगा, ये समस्या आएगी, ऐसे नहीं हो सकता है, वैसे नहीं हो सकता है। And in fact, I was told at least 100 times that why I shouldn't build here and why I can't build here, and even if I try to build here, how I can't succeed. But I think that was not necessarily my biggest issue. मुझे पता था कि मैं ये काम करके दिखाऊंगा, कर चुका हूं, करूंगा। You know what was the source of my always aware. राजदान सर, जब आपसे जैसे लेजेंडरी आदमी से मैंने मुलाकात की, तब भी मैंने आपसे यही बात कही। आई बिलीव इन द टैलेंट ऑफ कश्मीर। यू आर आउटस्टैंडिंग, एंड यू आर नॉट ओनली आउटस्टैंडिंग इन दिस रीजन, यू आर आउटस्टैंडिंग विद इन द कंट्री एंड अब्रॉड। आप बेहतरीन काम करते हैं। What I was trying to do is just create a platform where you could do what you knew, what you wanted to do. That is important. ये जरूर मेरे हमेशा मंशा थी कि जो क्रिएट करेंगे that should be world class, that should not be compromised. अगर श्रीनगर में हमने कोई इक्विपमेंट लगाया है तो वो ऐसा नहीं है कि गुड़गांव में लगाया और यहां नहीं लगाया, या यहां कमतर लगाया। We tried to give the best technology, the best infrastructure, and the infrastructure is all due to वसीम साहब, त्रंबू साहब यहाँ बैठे हैं, इनकी बदौलत एक बेहतरीन इंफ्रास्ट्रक्चर हम बना पाए। Honestly, when people come and see the hospital, some of them do get scared. लोगों को बर्दाश्त नहीं होता कि यार ये तुम मतलब इतना सुंदर है, इतना अच्छा है, तो शायद महंगा होगा। मैंने कहा बहुत घटिया जगह भी बहुत महंगी निकलती हैं। क्वालिटी इंफ्रास्ट्रक्चर, क्वालिटी पीपल, क्वालिटी मैन पावर डेफिनेटली कम्स एट अ कॉस्ट। अगर कोई दिल्ली में, गुड़गांव में हसीब जैसा यंग टैलेंटेड आदमी काम कर रहा है, वो श्रीनगर वापस क्यों आना चाहेगा? वॉट इज इट? The only reason he would want to come back is उसके जहन में एक मिशन है. He also wants to do something great, but he needs the same amount of remuneration, the same amount of infrastructure, and that is what we are giving them. डॉक्टर राजदान सर, आप लेजेंड सिर्फ इसलिए नहीं है कि आप ग्रेट डॉक्टर हैं, वो तो आप हैं, वो तो आई थिंक इस्टेब्लिश्ड है सबके सामने. यू हैव मेंटेन्ड द रिलेशनशिप इन कश्मीर इन द मोस्ट एडवर्स टाइम एंड यू हैव नेवर नेवर एवर सेड कि मैं यार भाग जाता हूं, मैं नहीं आऊंगा, मैं काम नहीं करूंगा. आपने अपना ताल्लुक बरकरार रखा है. दैट इज द अमेजिंग. सो सर, नोइंग यू, नोइंग माई कलीग्स हेयर, मुझे अपने फ्रेंड्स लगते हैं, मुझे कलीग्स लगते हैं, और आप जैसे सीनियर, और सर ने जो डॉक्टर काजी का तारुफ में हमने शायद कराया नहीं. डॉक्टर काजी फैमिली कनाडा में रहती है, आपने 35 साल मिडिल ईस्ट में काम किया है. सो इट हैज बीन अ प्रिविलेज नोइंग यू सर. आपकी बदौलत महान आदमी से मिलने का हमें मौका मिला, और ये मैं आप सबको, आई एम टेलिंग यू गाइस, दिस इज जस्ट द बिगिनिंग. वी आर हेयर टू क्रिएट एन इंस्टीट्यूशन, जस्ट नॉट अ हॉस्पिटल. थैंक यू सो मच.
Thank you so much, sir. As you rightly said, we are here to create an institution and not just another hospital. So I think that's going to be the core agenda. Now comes the time, डॉक्टर सुशील राजदान, जिनसे हम सब सुनना चाहते हैं, और इनकी एक्सपीरियंसेस और इनका जो ओवर द इयर्स का एक्सपीरियंस रहा है, ओवर द इयर्स का इनका जो तजुर्बा रहा है पेशेंट्स के हवाले से, ख़ास तौर से इनके कई ऐसे मरहले आए जब इनको यहाँ से बाहर भी जाना पड़ा, लेकिन उसके बाद भी एक कनेक्ट, एज डॉक्टर नागर राइटली सेड, कि वो कनेक्ट टूटा नहीं, और उस चीज़ को भी ये मद्देनज़र रख के हीलिंग विद ऑनर, एथिक्स एंड एम्पैथी इन मेडिकल प्रैक्टिसेस, तो उस पर मैं आमादा करूँगा डॉक्टर सुशील राजदान साहब को.
Good afternoon, friends. I welcome Mr. Nagar, Mr. Trimbu, Dr. Murtaza to be here, my friends, colleagues, especially younger colleagues, all through. I live in a world where I have one-to-one talk all the time. I'm not used to public speaking much, but I thought we could interact in between. We can stop in between and you can ask questions and you can get clarification. I was thinking what to say. You see, we doctors, all of us, have skills which are almost equal. The difference between any two doctors is 10%. But there are doctors who are very joyful in their work, who succeed, and some are always cynic and some are not happy with it. I think the most important thing is your inner physician, how happy he is with the work. In addition to being a doctor, you have an inner self inside which is always talking to you, and that I call inner physician. The inner physician has to be happy, inner physician has to be communicative. You see, decades back, as Nazir Saab said, the doctors were held in, the whole healthcare was held in very high reverence. Something has happened over a period of time, and there is a gap between patients look with suspicion, they are not sometimes trusting. Though it's not extreme, the truth is midway between the two. We had no technology in the past. Nowadays we have everything. We have vaccines, we have antibiotics, we have cancer therapies, we have beautiful machines, robotic surgery, everything. And in spite of these good things, they have a risk, and patients are mostly looking to the risks of these rather than the advantages we have. Although again the truth is midway between the two. You know, medicine is a team effort. But we usually take team as doctors, as paramedical, as nurses. But the most important part of the team is patients, attendants, caregivers. Somehow what is happening many times, you think they are our adversaries, they are not helping, they are hostile. Again, not all, but we should all have in this team trust and help of these people. Without them, patient care will remain. You may do the best of job, they may not be still taking you. We also have to understand all diseases cannot be cured, treated. All patients cannot get well. All treatments don't work. So even successful treatments are failures due to so many things. And in spite of all the technology, medicine is still a human effort, human endeavor. It is delivered by humans, it is administered by humans. And the most important thing of a doctor is his own knowledge, his own abilities, his own self, which is the most important investigation in treatment and diagnostic tool. And this is known as the consultation. If we ignore this part, you are creating a lot of problems immediately also in the future. without a proper consultation, which is the most important thing, we will have a lot of issues, and most of the problems we doctor faces because of time deficiency, because of high-tech investigations and overload in OPDs. We rush through patients, and that creates the problem. I think that's the most important thing would be that. And without a good consultation, doctors think we know everything about the disease. We need not see the patient well. We need not talk well. We need not sit well with the patient. If this perk is deficient, we become a lousy doctor. We don't become a good doctor. We don't become a perfect bedside. I say the room has to be proper. You should not be more higher elevated than your patient. You should be at the same level. The smile has to be there. Eye contact would be very important. You have to understand cues of the patient. Is he or she looking at you or looking outward? What is the reason for that? And the most important thing would be good listening. It has been seen most of the time, if the patient doesn't say a chief complaint, the doctor within 10 seconds holds him up. Hey, say like this, say like this. Patient may not have a chief complaint, he may have a story to tell. And most often they have stories, so many chief complaints. Knee pain, neck pain, headache, chest pain, so many things. You see, patients will never read a book and then come to you. They don't have chief complaints, they always have stories. And they, many times they don't come to you what we have got. They want to know what they think, what they have got. You have to just explain them, are they right or are they wrong, or what to do about them. I would stop in between and I could get feedback from the doctors, from so many people here, so that we could answer them rather than going on talking. Yes, from the younger doctors you could, your problems, what do you think? Boli, kuch puchiye. There are a lot of panelists here. I may not answer everything, but
मैं पूछता हूँ सर.
हाँ पूछिए सर.
I think a lot of us miss the relatives of the patient, the caregiver.
बिल्कुल.
हम लोग इतना focused होते हैं मरीज पे.
That's very.
Whereas maybe the 60% of the decision making is coming from the relative. मरीज तो मरीज है, शायद उसको तो he's not even in a position to make a decision or even understand the problem. I think we do miss. I mean, just from your 5 minutes of conversation, I've taken this point.
I'll explain it further. See, why do we make errors? The first and foremost error is everybody, you don't talk to patient. But no, more important is to talk to the relatives, friends and relations of the patient. The attendants are so important. And that's the most important thing we forget. This is more important in ICU care. In fact, I would love patients, attendants to come and attend your rounds sometimes when you have difficult patients, so that they understand how difficult it is for doctors to carry on day to day. You see, you understand doctors, you are such wonderful people. आप खाना नहीं खाते हैं, आप रात को डिनर मिस करते हैं, you work 11-12 hour shift, you sometimes don't have water during our residencies to take fresh water at night, washroom difficulties with it. Can there be more honorable work than that in the world? More noble work? You don't understand how noble work. We clean the shit of patients, we feed them through their riles tube, we put catheters into them. Can there be more honorable thing than this in the world? I think we should have pride in it. That is missing. We think we are doing a small thing. I think the most important.
There are two questions I want to ask. The first question, I remember my father telling me when I was trying to look for treatment, and I got into the hospital. तो रास्ते में जब वो बीमार हो रहे थे तो मैंने उनको बोला भारत हॉस्पिटल जा रहे हैं. क्योंकि मुझे हालत में बुलाने नहीं जाएंगे. मैंने कहा चलो फिर अब जब मैं उनको लेके आया अब वो यहाँ माशाल्लाह ठीक हो गए एवरीथिंग इज फाइन नाउ ही इज लाइक अब कब जाएंगे so it's like changing the perspective right so the question which I want to ask Dr. Sahab is like we live in a fast paced world right now right there is treatment and there is technology right so do you think this essence of apathy is getting lost somewhere between treatment and technology as a patient शायद पेशेंट को ये लगता होगा अच्छा जब पेशेंट किसी डॉक्टर के पास जाता है एक नोशन ये भी होता है कि भाई अब मैं डॉक्टर के पास जा रहा हूँ ट्रीट तो होंगे लेकिन मुझे पैसे भी बहुत खर्च करने हैं it comes into that right
I tell you, Nasir, it's a very interesting and most important question is treatment price. I'll tell you. You know, we have a hospital in India, Tata Cancer Institute, Bombay.
Yes.
It is a corporate hospital. You know that. Do you ever think about price of that? Everybody goes there. Same way powers should be here. Patients never worry about money. They say, but they say the hospital has to be good, the treatment has to be good. Believe me, they will never worry about an extra money, less money. They will never. But they have to have trust that I will get well. That should precede money. The day it happens, it's happening in patches, but it should be at a bigger scale. So any patient, any virus should know, money doesn't matter to him. Do you think a patient will worry about money for? He will try to find a reason.
The question was not per se about the money, Doctor. The question was that we spoke about ethics. We are talking about how we should go ahead with ethics and how doctors should respond. Unfortunately, the notion these days with the advent of social media and doctors being on social media and everything being thrown at your face, it's like when you see something, it's like there is a perceived notion कि अगर मैं वहाँ जाऊँगा तो शायद मेरा पैसा बहुत खर्च होगा वहाँ पे because he has some certain findings in front of him, tests हैं, बाकी चीजें, so कहीं ना कहीं आपको लगता है कि टेक्नोलॉजी की एडवांसमेंट से वो एपिटी का फैक्टर जो है
बिल्कुल that is the reason the gap has come.
Yeah.
Even patients, even doctors think I can shortcut everything by technology. This shortcut is causing problems. Believe me, that's not. And इसी से cost factor भी बढ़ेगा जब अपने सुनेंगे you will do more tests. When tests have to be this much, you will do more because you say पता कुमा ऐसे ये तो नहीं होगा वो तो नहीं होगा let us do everything.
But then there is one more thing which I wanted to highlight is like अगर आप किसी के टेस्ट करते हैं तो वहाँ कुछ नहीं निकलता है लोग कहते हैं इतने टेस्ट कराए कुछ नहीं निकलता.
The doctor has to be no that's what that will only come by active listening and deductions. I think doctors have to be this is the problem all over the world. देखो US में West में Europe में the problem is overburdened health care due to excessive tests and treatment. And cost of medicines is going up. We have to be very, very careful. Sometimes things are very important, necessary, not at the cost of missing a diagnosis.
So the question is also open, everyone can ask questions. Hasib, here's the mic.
Just a quick comment on what Hasib said. I think when you spoke about kind of doctor bashing, it has become a fashion in the community right now. And I'm extremely sorry that our journalist brothers have actually played a huge role in that. And I'm sure you'll agree with that. When there is any incident and you call it negligence or you call it, any gross negligence or any act of commission, without having the other part of the story from the doctor, what exactly has been happening, the proper inquiry, whether it was negligence, whether it actually happened, and we need, show those doctors as negative faces, and then it becomes a trend. The social influencing and people trying to get the, advantages for that, and everybody coming with a mic, and you don't even need a camera these days. You can use your mobile phone. I think that has played a huge role, and it is a huge responsibility of all the brothers and sisters to actually get to the crux of the story and bring out the truth. The truth should be out, the truth should always prevail, but it should be the truth, not the tainted, stories of the community thinking that doctors are weak, all the doctors, no, we cannot generalize things. And the question of apathy, I think I still agree. Again, the reason why doctors do not want to comment is because we used to have an era where we were taught by the mentor saying that You should have a differential diagnosis 1, 2, 3, and then you should get the patient's evaluation. If you do it today, and then you tell the patient that this is my first, second, or third diagnosis, and then you get a CT or something else done in something else, then just put a question mark on your credibility. So you have to play safe. It is the changing dynamics that has had an impact on how doctors are behaving.
Since there are medicos, non-medicos, this forum is open for all of you.
Anyone can ask questions. It's open. The floor is absolutely open.
Can I answer a little? Not answer. Doctor, you see, our as doctors, we should be alert to that. We should make an error. We cannot change them. We have to keep our house in order. And the most important causes of errors, I told you, is not talking properly to patient and the caregiver. I think it has to be repeated. This is the most important cause of legal problems, as Dr. Wahid said. Most important. It has been seen, it has been proved scientifically, two groups where it was talked well as surgeons, two groups of orthopedists, where it was talked that doctor had least legal problems as compared to doctors who would talk less to them. That's one. Number two is overconfidence. Sometimes we are very overconfident about, not only about the diagnosis, about our way of work. My junior will see, we don't sometimes answer calls which are important. We have to devise a system where patients don't think that we are arrogant or we are superior. That's very important. The third reason is we have to own a responsibility. See, there is a sick patient in hospital. The patients have to know that this doctor is looking, he's sitting with me, he's asking me, he's making proper investigation, he's proper out. Once he sees the doctor involved, believe me, no power on earth can remove that attachment or connect. Don't forget about the who writes what. Why it's not our problem. So many things used to be written against us in time. The people who did it would come and apologize later by our enemy. I remember a patient, I'll tell you, we had a patient from Uri. He had a cervical spondylitic myelopathy. It happened in late 90s, Dr. Nagar. He was an ex-army guy. It's early night. I referred him to Moolchand. Dr. Jawahardar used to be my friend, neurosurgeon. You see, things can happen. He was walking when he came to me. After surgery, he became quadriplegic. He started calling me there. After a month there, he came to my clinic, very shanty place in England, and abused me literally that you have a milli bucket. This is what happens when you take money. I told him, get the patient in now. I found him distended with feculates. Maybe this is a true story. That was the only way. I got a goggle with his gloves, took all his feculates in the open, cleaned him, bed soap, then gave him treatment. The attendants still date are not leaving me. He's still walking on the walker. The whole thing can go off with your eyes and your arguments will not change unless you own it. Even if they have a perception about something, the only way it can go off is with your joy of working on that. You have seen. I'll give you an example. There is a worm, caterpillar inchworm. It has 6 legs in front, 4 behind. In between is a body. It climbs marigold, inch by inch. We do same thing, inch by inch we see it. And probably that inchworm enjoys that marigold scenery. We have to enjoy this mysterious patient, his beauty, his stories, his illnesses, his ada. How can he leave you? How can she leave? ये बात ही नहीं बनती है. You become, I shouldn't say this word, you become God to him. Never. वो देखने आते हैं फिर. And it takes time. Youngsters have to understand it takes time. It takes 5 to 10 years. It doesn't happen a year. And you can always earn enough honestly, as Dr. Wahid used to tell me. All doctors can honestly earn enough.
Thank you, sir.
I'm a bit mesmerized. We can see why you are what you are. I think because I haven't had the pleasure of interacting with you quite so much, but I think in the last 10 minutes I've understood fairly well why you are a legend. You mentioned in passing about the importance of the consultation. And I think this resonated very deeply with me because the importance of a good history and a physical examination is vastly understated, vastly understated. And to this effect, the problem we face as clinicians, at least I do, is getting WhatsApp forwards of reports. Yeah, just come.
Instant, Jinn.
And then, let's say like until a few years ago, I would deal with them slightly differently. I would elaborate my response because I had some time. But I think we need to educate not only the general masses, but our own fraternity, that we cannot make clinical decisions based on a report. I'll tell you some examples, which I'm sure we all
very important, very
relate to. Most people who have arm pain do not have a problem in their neck or cervical spine. So if you forward a WhatsApp report of a cervical spine MRI that you have got of your own or been advised by someone, and you expect me as an expert to give you proper treatment based on that, you are very mistaken, with all due respect. Because even I would not do that to myself or my family. I will only order an investigation, for example, an MRI of the neck, once I have seen the patient, listen to their problems, because every problem, most problems have a pattern of symptoms. That's a pattern we are trained to recognize. And then the rest comes from when we touch you, when we check for some stuff, right? We elicit signs. And then that history and that examination marries up, it leads to a certain relevant investigation. It may be a shoulder X-ray. 90% of the times people get treated as, what's called very popularly cervical-brachydactyly. I did treat it as not knowing what you're talking about, because there is nothing like that. If you have a problem in your cervical spine, you will have a radicular pain or you will have bleeding. Okay? But most often these patients, in my experience, have problems in their shoulder that I could have diagnosed without an extensive MRI with just 2 minutes of examination. And this applies everywhere in the A doctor needs to examine. I don't know, I would like to get your views on this.
Before Dr. Sushil responds to this, I request everyone to be precise, brief in their question. Commentary can be done later on, but we can have a separate session on that.
I would expand it. See, when a patient sits in front of you, young doctors, sometimes you feel how to go about it. Just cool down, relax, don't look here and there, and make 5 checkpoints. First is connecting. Just normal thing. Don't try to make a diagnosis. खुद ही आता है, उसमें क्या मुश्किल? And once the patient nearly finishes, you summarize for him. So kal do 8 reto pet maiz karan drok shiva finish, and then hand over after examining the. But 2 things are very important. As Dr. Vahid, safety net. You have to tell him problems which can arise, uncertainty of allergy, a rash, or the evolution is another reason why we get problem. And last and most important would be your housekeeping. Take care of yourself. Don't burn out. Sleep well. In between the patient, if you get tired, go off, retreat, have a wash, take some food, take some snack, come back, and break your clinic, break your work every few weeks, every week to rejuvenate. And medicine you will do all life. All life you will do medicine. You cannot escape it. This is your job, this is your profession. But please travel a lot, see your friends, read books, go to museums, go to zoos, have some other. They are more important because the work you are doing, you will always do it. The other things are more important. Choosing your friends, choosing the good books, having a nice movie, good music, they are very important. Two, I call it housekeeping. If we will repeat it, you connect, you summarize, you hand over. You keep a safety net, and most important for you is housekeeping, how you keep yourself. I think.
We have Nasir from the
Doctor, you have been treating patients for long, since last 5 years. I have a journalistic question. What was what kind of patients you would witness in 80s, in 90s, and now? Say, for example, having a mental disorder, psychiatric disorder, or neurological.
Very important question. Absolutely. I see lot of geriatrics now. This was not in 80s and 90s. We see patients who are in 80s, late 70s, 80s and 90s, huge numbers. About 40% per day patients are elderly with strokes, with dementias, with falls, with Parkinsonian, with frailty, and effects of multiple drugs. This is the most important group of patients. Another group we see is newer, which we wouldn't see, side effect of drugs. It's very interesting. Majority of drugs, if they cause issues, most of the issues are in the nervous system. Giddiness, falls, urinary problems, constipation, anything. These are very common. We see problems because of drugs, and we see a lot of geriatrics. The pattern of rest of the disease are same. Epilepsies are same, strokes are same, developmental disorders are same. We see children more with autistic, whether it is due to more knowledge or we have more numbers. We don't have reliable data here. We see developmental disorders in children more.
In case of depression, mood disorders, what was the pattern in 1980s?
No, you are right. Because of the situation where we had a lot of post-traumatic stress disorder. Unfortunately, we had another guest speaker, Dr. Margoob. He couldn't come, he was in Delhi. He would have answered you much better. They have seen huge avalanche of psychological disorders in Valley. And that spilled over even to Jammu, we would see them. Lot of anxiety, lot of depression.
We'll take 2 more questions. We have one question from Mozam from East Bharat.
Mozam, I have a question for you. That we have seen that medical science has advanced over the years, and also new facilities have come up. But what does it take to be Dr.
I don't know myself. No, believe me, I don't know. I think joy in your work, that's very important. You have to enjoy your work. I request you, got to enjoy. There will be, see, I'll tell you one last question. Why sometimes you don't like a patient? Many times his manners are not good. He got a lot of sifarishis. He is all the time pestering. I'm waiting. There you go. Now your mind is very upset. This patient is sticking to. Don't talk. Listen to him. I tell you, you will like him. I used to get very angry for so many things about a patient. So many things you will not imagine. Choti baat par. मैं उसके प्यार में. These are true things. I sit. You will enjoy him. He or she will become a fan, and always have pictures with you. The maximum pictures of anybody in J&K will be with my patients. Dandar chala. I think that's it. Dandar, you will understand. Naveed Nufur, come here. Talk and walk. What will be? You are an ace practitioner.
Thank you very much, sir. It's a pleasure being here with our teacher present. So since we are mostly working in the government sector, I think the picture is totally different if we compare with what we have, if we compare ourselves with the corporate sector. being compassionate with the patients. There's no doubt about that. The patient will not trust you if you are not compassionate with him, if you don't make a direct connect with him. Treatment anybody can write, and I think in government sector we have to strike a balance. We don't have so much of time like you have in your private clinics or in corporate sectors where you can give adequate amount of time to the patients. So we have to be in government sector, we have to strike a balance between giving appropriate treatment, connecting with the patient, and then making the patients convinced that you are treating him in the right manner. So I think it was a learning for me also, so hearing from the legend, and I think speaking about Paras, I think this has given a new dimension to healthcare in J&K, because we have so many hospitals, what you call hospitals, in Kashmir division. But even before Paras, I told everybody there is actually no hospital. These are just nursing homes which behave like polyclinics, where people go, doctors go in the evening. But if you really have an emergency, be it from a higher class person or from a lower class person, the only avenues which are available were schemes or SMHS. But now you have a hospital where you can trust that if you have some emergency at home, and you will find some very, I will not say some, but very good health care which you can rely upon, be it any kind of emergency. So I think that gives a definition about having a corporate hospital. Regarding prices, what people were talking about, see, actually what actually happens here, once a person comes to this corporate hospital, he does not compare it with a corporate hospital. He always compares it what he gets it at a government hospital in Kashmir or any so-called nursing home or a private nursing home. So these are totally two different things. If you see, there were hospitals which are different ball game. So the cost factor has to have a difference. Anybody coming here should not compare it with another government hospital or any hospital here, but actually with the corporate hospitals once you are going out. People often complain it only here. Once the same patient goes to Delhi, be it Paras or any other corporate hospital, he goes with a fixed amount of money and never brags that he has been overcharged or anything like that. So I think the message has to go to the public that, and I always tell Umar Seem, I always told him that Paras is going to run very well once another corporate hospital comes here. Because what actually happened, the other corporate hospital will also come, they will have having a comparable rates, and then Paras will have a greater trust among the people that this has been running for so many years. And I think that's it, what I wanted to say, because it was not, I had not come prepared for being here. So thank you very much, it's an honor being here.
Thank you so much, Dr. Naveen. Dr. Naveen did some remarkable work during COVID times. And for that he was also awarded and also mentioned in Man Ki Baat by the Prime Minister himself. And I think probably Dr. Naveen also received a call from Prime Minister, which was also featured by a lot of newspapers. Dr. Naveen is again an asset to the whole medical fraternity. Someone who doesn't want to come on the record has sent me this beautiful dedication and a tribute to Dr. Sushil Razdan. हजारों साल नरगिस अपनी बेनूरी पे रोती है, बड़ी मुश्किल से होता है चमन में दीदावर पैदा. तो कहते हैं कि he says कि ये मेरा एक डिस्क्रिप्शन है राजदान साहब का, राजदान साहब को डिफाइन करने का, और राजदान साहब की जो जर्नी है उसको बयान करने का. हम और एक सवाल लेंगे लास्ट पे, खास तौर से हमारे नर्सिंग स्टाफ से एक जूनियर मोस्ट, एनीवन हु जस्ट वांट्स टू हैव एनीथिंग सो दैट बिफोर वी कंक्लूड द सेशन. सनम वांट्स टू ऐड फ्यू थिंग्स. हाँ बोलो, आओ इधर.
The senior doctors have to encourage youngsters, advocate for them, and make them flourish. Make them flourish. This is lacking in medical science, isn't it? Well,
respected dignitaries, my seniors, fellow colleagues and esteemed guests, Assalamu alaikum and a very good afternoon to all of you. It's a great honor and privilege for me to stand here today in front of such experienced and dedicated professionals. My name is Sanam Gul and I'm working as a nursing staff in the Department of Emergency since last 3 years. That means from the very beginning of the Paras Hospital. I'm the first nurse of Paras Hospital, Srinagar. Today, I'm here to speak about the values that defines the very soul of nursing. Healing with honor. A topic that is not only important for our profession, but also deeply connected with humanity and compassion. In a world where medicines are advancing every day, where technologies are becoming more powerful, there is one thing that remains timeless: a human touch of a nurse. As nurses, we are the essential part of healthcare system. We are not just the caregivers, but the healers, the listeners, and the silent supporters. We remain beside the patient's bedside in most of the vulnerable moments. When the patient is in pain, when the patient is afraid, and when the patient feels alone. Caring for patient and respecting them as a human being and not just as a case is what truly honor with healing means. So, a nurse, not only a name, but a responsibility. Thank you so much.
Thank you so much, Sanam. पूरा तैयारी करके आई थी. So she wanted to deliver a full-fledged speech. And thank you so much, Sanam, for that thought. Sir, आप खुद ही अपने अल्फाज से conclude कीजिए. And if you
that was very important. Medicine is the only profession where youngsters are not very happy. You talk to medical students, you talk to junior doctors. This is not so in other professions. You talk to a young lawyer, he will work with a very senior lawyer and he will value him. You see, you have young entrepreneurs, they flourish, and then you will get bright people back and they will enjoy this profession more. And for seniors, it's very important to advocate for their youngsters so they follow your shoes, they follow you in the long run, and that legacy should continue, I think. And the last question is, please relax, listen, enjoy the most important human being in front of you. What more do you want? You're talking to a patient, his life, his stories, his thing. You, in fact, live in that moment. You will never get tired. You will never get tired. Thank you so very much for that.
Thank you so much, sir. Thank you so much, Dr. Nagar, Dr. Naveed, Wasim, Dr. Murza. I would formally request Dr. Shafat to have a vote of thanks.
Assalamu alaikum. Good afternoon, everyone. On behalf of Paras Health Srinagar and Paras family, I would like to thank you all for gracing us and believing in us and the trust which we are trying to build and which we are. As in our words, we say we have a vision and mission. So our vision is to provide tertiary care and quality care, and mission is to be affordable and to reach every community and to provide whatever facilities we have and be open to everyone. So I think the session as concluded by our senior dignitaries, the doctors, the mission is clear that we are affordable and we want to be trustworthy and we want to build that trust which the patient should have in us.
Thank you everyone. Thank you Nagar sir for giving us that platform to helping our society. Thank you.
सर एक ग्रुप फोटो के लिए यहाँ पर ग्रुप फोटो लिए साइड ग्रुप फोटो लिए
Join. Should be a big one.